So I want to talk about this new report from the New York Times, which details the prices that hospitals charge private insurance companies for various healthcare procedures. Now, if you are one of my viewers who have been listening to me rant about healthcare for years now, you're not going to be too surprised by this. But still, I think that the findings here are really fascinating because it basically proves what we've been saying on this show for years, that healthcare in the United States of America is a total scam. And I think that once you see these numbers, there's no way you don't get radicalized because we're getting taken advantage of here. We are getting screwed over. And all you have to do is look at a couple of examples of what people in America are charged for healthcare and how arbitrary those prices are depending on who their insurance provider is. So let's get to this. So this is from Sarah Cliff and Josh Katz, who report this year the federal government ordered hospitals to begin publishing a prized secret, a complete list of the prices they negotiate with private insurers. The Insurers Trade Association had called the rule unconstitutional and said it would undermine competitive negotiations. 4 hospital associations jointly sued the government to block it and appealed when they lost. They lost again, and 7 months later, many hospitals are simply ignoring the requirement and posting nothing. But data from the hospitals that have complied hints at why the powerful industries wanted this information to remain hidden. It shows hospitals are charging patients wildly different amounts for the same basic services, procedures as simple as an X-ray or a pregnancy test, and it provides numerous examples of major health insurers, some of the world's largest companies with billions in annual profits, negotiating surprisingly unfavorable rates for their customers. In many cases, insured patients are getting prices that are higher than they would if they pretended to have no coverage at all. This secrecy has allowed hospitals to tell patients that they are getting steep discounts while still charging them many times what a public program like Medicare is willing to pay. And it has left insurers with little incentive to negotiate well. The peculiar economics of health insurance also help keep prices high. Now, they provide us with a couple of examples that really showcase the absurdity of this system. So when it comes to the cost of a colonoscopy at the University of Mississippi Medical Center, well, if you have Cigna, it's going to cost you $1,463. If you have Aetna, you're going to be paying more than $2,100. However, if you have no insurance, you'll be paying $782. This is bonkers. I don't know what to say about this. If you want a pregnancy test at the hospital of the University of Pennsylvania, well, if you have Blue Cross Blue Shield, it's going to be $18. But if you're a Blue Cross HMO patient in New Jersey, that is going to cost $58. $93 for Blue Cross PPO patients in New Jersey, and with no insurance, $10. At Aurora St. Luke's in Milwaukee, an MRI is going to cost $1,093 if they have United's HMO plan and $4,029 if they have United's PPO plan. That is a gigantic difference. Now, at hospitals in the Erlanger Health System in Tennessee, if you want a flu vaccine, that's going to cost $54 if you have a Cigna plan, $104 if you have Blue Cross, and $201 if you have a United plan. At Memorial Regional Hospital in Florida, an MRI is going to run you $1,827 if you have Cigna, $2,148 if you have Humana, $2,455 if you have Blue Cross, and $262 with Medicare. That is a giant difference. So that is just a little bit of insight into this insanity. And that's only the hospitals who actually complied. Most hospitals, the article states, did not comply. And they're going so far to hide the prices that they charge to separate insurance companies that they're willing to spend $109,000 per year in the fines to hide this information because they know it's that incriminating. I mean, if this doesn't tell you why we need Medicare for all, then nothing else is going to get the point across. But Medicare for all is a single payer system, which means all of these insurance companies would go the way of the dodo, right? We regulate them out of existence, and we have the government be the sole insurance provider for all of Americans. And that's why you can see that, Medicare gets better costs than these insurance companies. But what this also, I think, tells us is that we really should move the goalposts when it comes to healthcare. And we have to acknowledge that Medicare for all single payer, this is really a compromise position. What I would like to see is a nationalized healthcare system where hospitals are actually nationalized, because I am of the belief that healthcare should not be an industry. Healthcare should not be commodified. Healthcare should be free at the point of service. And so long as you have these for-profit, privately owned companies in the mix, they're going to do things like this. And single payer would drastically improve our healthcare system. But there's still going to be these private hospitals that care at the end of the day about their bottom line. And they're going to make decisions on the basis of what makes them money, because these are businesses. So I think that progressives should continue to advocate for Medicare for all, single payer. But on top of that, we also have to start educating people about the benefits of nationalizing hospitals in America, making our system reflect the UK system, which is imperfect, right? It's not the end-all, be-all. It's at risk of being further privatized by Tories. But if we don't start talking about totally removing the cost incentive from these systems, then I think that we failed as leftists. Because sure, insurance companies, they are the lowest common denominator when it comes to most of the insane costs that Americans have to pay. But it's also hospitals too, right? They're part of the problem. And I think that we also have to have a conversation about their role and us needing to get rid of these private companies in all of healthcare, because this is ridiculous. I mean, imagine if you went to a store and you wanted to purchase a video game, Elden Ring. The cost of that game is going to be $60, $70. But imagine if they said, actually, you have to spend $150 on this game because you're from New Jersey. Well, that wouldn't make sense, right? Just because you're from a different state, why would you have to pay more for this video game than other people? It's totally arbitrary, right? Well, they would only be able to get away with this if people didn't know that was happening. Like if you were from New Jersey and you just always assumed that video games were $150, well, you wouldn't necessarily worry about that. But if you learned that other people are only paying $60 to $70 for games like Elden Ring, then you might get angry. You might want to change the system itself. And that's why they're willing to pay that fine every single year if it means that they can hide this information from the public. It's truly, it's fascinating, and it speaks to how reprehensible these businesses in healthcare are. There shouldn't be a healthcare industry. There should just be healthcare, period, because that's what's achievable in the richest country on the planet. Nationalize these bloodsuckers, abolish all private insurance companies. Let's have a healthcare system that's actually centered on human need, not human greed.